Hello, LA Christian Health Center's Facebook. We are live again today. We are on the streets of Skid Row, right near Gladys Park. And we're here with our partners, LA County and the C3 teams who go out and do street outreach. We're here as the medical partner to deliver HIV tests, hepatitis tests, and also syphilis tests to the community today. We'll get a chance to talk to Shannon Fernando, who you guys have met her and seen posts about her and her writings. We'll get a chance to talk to her. And today I also have Dr. Lisa Abdishoo, who is the president and CEO of our organization. Dr. Lisa, why don't you tell the people a little bit about how we came in to do street medicine at LA Christian?
Good morning. Yeah. Well, you know, street medicine has been kind of a part of who we are from, I think, the very beginnings of the clinic in the early 90s, because we were founded by the Los Angeles Mission and sort of had that real focus on serving the community of people experiencing homelessness in Skid Row. And in those early days, that included the people who were living at that shelter, at the LA Mission, people who were in their program, but also going out to the streets and the surrounding area. And in those days, they had this old donated 1970s RV that they used to take out. And that was still working when I first came to work for the clinic in 1999, but it died a little bit thereafter. And then over the years, we've just tried to incorporate street medicine as much as we could whenever we had a funding stream to do that. And that has kind of come and gone over the years a few different times, but in the last 3 years, it's been going really strong thanks to Measure H funding that comes through the County of Los Angeles and our partnerships with the People Concern and PATH for that Measure H funding.
Very good. And now we're partnering still partnering with LA County. And what I'm showing you guys here is just our team preparing the tests that have been taken inside. We have Carolina, who's out here. You've met her before. She's a star on our page. She's part of Shannon Fernando's team, and they have been together throughout this COVID experience. They've been at the beach, they've been at the mission, and here they are again with their team taking care of the folks on Skid Row. Dr. Lisa, how often do we go out now with the street teams?
We have staff out on the street teams every day, Monday through Friday. And in fact, on any given day, I was just kind of looking over all of our different street medicine staffing plans and patterns and schedules. And basically, on any given day, there's about 5 different teams that we're out on. 2 of them are partnered with the People Concern. And so, no, 3 of them, sorry, two teams in Skid Row and another team that's called Skid Row Adjacent. Kind of goes from that Civic Center area around Tokyo, the Arts District, and sort of the perimeter around Skid Row. And then the 2 teams that are partnered with PATH, People Assisting the Homeless. One of those is what we call the Metro Red Line team. And it kind of starts at Union Station and provides street medicine inside the train stations and metro stations all along the Red Line. And so it kind of includes going onto the train, onto the platforms, and also for like about a 1-block radius around those stations. And then the final team that's out every day is we call it PATH Long Beach, but actually it's Service Planning Area 7. So it's all of the sort of eastern and southern cities of LA County, like Whittier and Downey and Bell, down to the northern border of Long Beach. So 5 teams on any given day. And those are made up of, I say team, but really they're made up of our medical staff, which is usually either a registered nurse or a physician assistant or a nurse practitioner. And then they're joined together with case managers and outreach workers from our partner agencies to kind of create this multidisciplinary approach.
Very good. It looks like things are really cooking up here. The C3 team has been doing their job, by going out and capturing folks to come and take tests. Do you mind? Do you have a minute? Can you chat with me? Can you chat with me a little bit? Okay, okay. Like I said, there's a lot of folks out here, so staff is really busy now. But I just want to show you guys kind of what happens when a person comes up. This is the inside of the unit, which is clear. There's nobody in. Can you hold on for this? There you go. I'm just gonna show you guys here. Shannon, yes. Team again, testing. Well, and I think that part of this work is so important, and getting out here with the folks and not only providing the healthcare, but also anybody who is here who comes to take the test actually gets a lunch. So I think that makes it a little popular. I'm not sure what's in the lunch. I think it's hot dogs, an apple, and some water. So people don't mind coming out when they're getting a little something in return. Just gonna go slowly and show you guys as much as I can. If you're just joining us, please click like and click share. Tell a friend. Dr. Lisa mentioned that, you know, in the history of LA Christian, we've done street medicine as often as our funding allows. But this is probably an area that we could use independent funding for, you know, where it wouldn't have to be available just because a major funder, you know, wants to do it. Dr. Lisa, what is the cost for something like this? Even if we had just a street team to come out once on their own as a medical team. I know I'm putting you on the spot with that, but what does that, yeah, well, you know, wondering what does it cost to just have, well, a team like this with LA County involved? It really takes partnership. I think that's what we know for sure, is that, and LACHC is great at partnerships, and that's, I think, why our reach is so significant in Skid Row.
Yeah, yeah, but you know, every little bit helps. I think a full-time team to be out on the streets costs something between $250,000 to $300,000 a year, including all of the, you know, sort of supplies and overhead and all the things that go with it. So you can kind of divide that up into, you know, part-time would be half of that, you know, however you might want to look at it. But I think every little bit helps, and whenever we can be out there, it really makes a difference. You know, sometimes it looks like the way it looks today with the, you know, partnering with the testing van. Sometimes our team's just out there with backpacks. Most often our team's just out there with backpacks, walking from tent to tent, walking on the sidewalks. And so it's a pretty cost-effective, cost-efficient, you know, model. And we do it in such an innovative way as we can. But you're right, it's so critical, especially when you kind of keep in mind that we're trying to bring healthcare to a community that has lost trust in the system for a lot of good reasons, and can be really, really hard for folks sometimes to want to go in the doors of an agency. But if we can bring the healthcare to them and begin the relationship where they are, you know, it can just start to break down those barriers little by little. And we've seen that just bears so much fruit.
And for some people, you know, may ask, you know, what is the benefit of street medicine? Because most of us, we go to our doctor's office. We don't get house calls, so to speak. But as you mentioned, in this environment where folks have really lost trust in many of the systems like healthcare or housing, when they're at this level, for us to bring those services to them here can make a significant difference, not only for them individually, but also for public health outcomes, right? I think that I mentioned the test that we are taking today, hepatitis, HIV, and syphilis. And I think that one of the reasons for that, doing this outreach now to get people tested is because there has been a noticeable uptick in these cases, for women in particular. So it's a good thing that C3 and LACHC can work together to target things like this. We didn't go live, but we did post pictures when we did COVID testing at the mission. So it gives us great flexibility to have such diverse partners in doing this work.
Yeah,
So,
I was thinking, when you think about COVID, we've done about 5,000 tests overall across our organization so far since the start of the pandemic, but almost half of those, about 2,500, have been done out in the field, and whether that was at shelters or out on the street. And I know probably close to 2,000 were done out on the street. When you look at the conditions that we're able to screen for and diagnose and treat, you're so right about the public health costs, because these are all things that if we can catch them and treat them early and prevent the spread and sequelae complications, then actually, reducing the burden on the public health system as well as helping individuals.
everybody wants to talk to me, so I'm not putting anybody on camera but me. But there's a line here, and they're just concerned about being on camera. So I put myself on mute because I want them to know that I'm not taping them. I'm just taping myself. So, but it's a great feel out here, because I think that some of the folks who I mentioned that we are at Gladys Park, we're parked just outside of Gladys Park. And we're just gonna, ooh. Okay, I just want to try to get in on the action in front of me and follow Shannon. Maybe we could just watch them work, see how the teams kind of handle things. And thank goodness it's a cool day. Wind is blowing. It's not hot and sweaty. And I don't know, to me, it seems like we've tested and seen a good number of folks this morning already. We opened up at 9, and at 9 o'clock, there are already folks here waiting to get service. Dr. Lisa, if someone, let me ask Carolina if she knows. Carolina?
Yes, ma'am.
What happens if someone wants something other than a test today? Are we referring them anywhere, or?
Yes.
Okay.
So we have some flyers for our Midnight Mission Clinic. We have some flyers for Joshua House. And then we will redirect the patients to get some care to our main clinics.
Good. Thank you. This is Carolina, guys. You've seen her. She's one of our Facebook leaders. You see Dr. Lisa there?
Yes, I do. Hi, Dr. Lisa. I'm like, Renee, you put me on the spot.
Yes, I did that. How's it going? Is it going okay? The flow?
It's going good. We're definitely getting some testing, so we're excited. We're excited to serve our patients out here. So.
Yeah. When was the last time the team has been out here near Gladys Park? Do you know?
So with our partnership with C3, we rotate to different areas. So we visit this area probably like weekly. So it's routine for us to be here. That's why our C3 partners have good connections with the patients.
Very good. And there's a heavy flow of folks,
yes,
so they
definitely.
seem to know everybody. Thank you, Carolina.
No problem.
Okay. So yeah. So because they come out here weekly, the C3 folks know the folks who live here. Often when I talk to people about Skid Row, I always want them to know that above it's many things, but one of the things Skid Row is a community. It is a community and a network that includes support services like what we do at LA Christian, and often our providers and people who work in our clinic are absolutely part of the community, and our patients and the folks who make this there, who are living here, consider us a part of their community as well. So I always love to tell the stories about when I first came to LA Christian, and Dr. Lisa and I would be walking the streets together. And I don't know, Dr. Lisa's been with the organization for more than 20 years.
Yeah.
And when we're walking down the street, there are people who we might encounter who will holler out, "Hey, Doc," to her. Dr. Lisa, you've cared for this community as a physician for so many years. Can you tell us just a little bit about, what drew you here? Because I'm sure people are wondering, why are these providers, what makes it okay? How are people open to do services in this area?
My journey with providing care in Skid Row and getting connected with the clinic kind of started in my residency, because I was doing my internal medicine residency program at Cedars-Sinai, and Cedars had actually kind of helped start up LA Christian Health Centers in those early days when it was under the LA mission. They had created an academic partnership where they would send the residents over to the clinic for what they called our continuity clinic, where we would come all throughout the year. And that was really my first exposure to Skid Row, other than coming down to serve Thanksgiving meals when I was a kid with my parents. But, once I got there, I think, and started seeing patients, I think I got hooked really quickly on just everything about it. A lot of it was just meeting so many great people, both the staff at the clinic, which was very tiny in those days. They had about 5 staff, but meeting the staff at the clinic, seeing what a difference they were making, but meeting the patients that would come in and learning about their journeys, and learning that healthcare could be a real important part of that journey of recovery. We were working with a lot of people who were in the LA Missions rehab program. And I kind of had that opportunity to see how people were getting their lives turned around, but also how they really couldn't do it without the healthcare coming alongside, because so many people would, when they would be coming off the streets, had been off of their diabetes meds, had been off of their blood pressure meds, had untreated HIV, had conditions that, really, and that became, that was just a crucial part of their recovery.
Okay. I have someone who wants to talk to us, I think. So at first she didn't want to. I'm thinking, should I go talk to her or not? I'm just going to leave the camera on me, and I'm going to talk to her and say, yeah. Let's see. Hey, sis. Well, I don't have you on camera because you said you didn't want to.
No, it's cool now. It's cool. I thought about it.
You feel okay?
Yes, it's okay.
Okay, well, let me put the camera on you.
Okay, cool.
Okay?
Okay, cool.
And I want you to just first we are actually on Facebook Live with LA Christian Health Centers, and we're just showing the people what we're doing out here with the C3 team.
Okay, cool.
Okay, hold on. I'm just going to put the camera on you. Actually, I'm going to do it like this. Woo. Okay, there you go, sis. What's your name?
Maddie.
Maddie, how are you today?
I'm okay.
So what brings you out here? Well, tell me about what's happening.
I've been out here. Well, I have a city called Houston, but my name is Maddie Tajetta Johnson. And I've been out here since 2000. I've been trying to get my housing and all that type of stuff.
Are you a patient with us, or are you just here to get testing? Do you know about Joshua House and the clinic?
No, I don't.
Okay, yeah.
I see a building on down there.
Yes.
Really nice.
Yes,
I
yes.
hope I can get a place up in there.
Very good.
I've been waiting to get my own place for over. I've been out here since 2000, and I've been waiting to get places over 3 years. I done got beat up, raped down here, stabbed, and all that.
Well, listen, I'm glad. Thank you for talking to me and sharing what you've been through. I'm glad you're here looking after yourself to get tested. It's important. Keep
I'm
at
happy.
it.
I'm happy you
Yes.
got me this stuff.
Yes,
I'm
very
happy
good, very good.
because I got OCD.
Well, thank you. Thank you so much. Yes. So, so there you have it.
I'm with FSP Mental Health.
Okay,
So
very
I hope
good.
that they get me a place. You know, I've been waiting so long.
Yes, yes.
JD and Ellen is my workers, but we'll see.
Yeah. And that's a priority for everyone. I think many people want to get off the streets. They want a home. And we're connected with so many other programs that are related to rapid rehousing through the C3 teams and also Project Room Key as it relates to COVID. Dr. Lisa, can you tell the people just a little bit about what I call our no wrong door or no wrong door entry to housing through coming to the clinic?
Yeah, I mean, we really like to look at healthcare as kind of a part of the doorway to housing, and oftentimes it can be because there are folks who are living in a homeless situation who maybe aren't ready to go in and start looking for a place to live, right? They may not even quite want to get housed. They may feel like their current situation is okay on the streets, but they may come into the clinic. They do want to test for something, or they've got a toothache, or they need glasses, one of those pressing needs. And I think when someone comes in the door and, you know, whichever door it may be, and starts to connect with staff and to get those services, our goal is to kind of help them along on their path in every way that we can. And so oftentimes the story that we'll hear is someone came in because they had a laceration that needed stitches, or they had a toothache, but eventually one of our staff convinced them to see one of our case managers. And ultimately that led to starting to think about housing, maybe just taking some baby steps, maybe somewhere along that journey, it includes going to see one of our mental health providers and starting to get therapy, and work through, you know, issues of trauma or depression or anxiety. And then, you know, that becomes part of that pathway towards recovery and housing. And we also do a lot of partnerships with agencies that do housing. So for instance, on our street teams, we are partnered with the coordinated entry system, some of the coordinated entry system leads, the People Concern and PATH. And so that on these teams, they provide the case managers who do the housing linkages, which is just an amazing synergy between sort of the medical and the housing side. And of course, another really exciting connection is our new Joshua House building, which is really nearing completion and hopefully going to be opening sometime in the next 8 to 10 weeks, let's say, if all goes well with just getting through the last of our inspections. But that's another really awesome partnership between the healthcare and the housing, because we're actually bringing them together into one building in just a really beautiful way. And our clinic's going to be 3 stories with 25,000 square feet, but above that, there's 4 stories of permanent supportive housing, 55 units. And so, you know, there's lots of ways that we're going to create linkages between the clinic and the housing itself, some new ways and some new innovative things.
Yeah, yeah. Well, thank you all. I think we really should, because just up the street from us, 1 block over is our new clinic. We're maybe on about 4 or 5 blocks away from it. Thank you guys for coming on to join us to take a sneak peek at what's happening with our street teams. We'll see you real soon. Please share the video once it's uploaded. Like us, follow us, comment. Thank you all for being with us. I'm going to sign off. This is your friendly fundraiser Renee with LA Christian Health Centers, signing off for LACHC Live.